Hello and welcome everyone to the second oral mucosa practical session. We have firstly spoken about the lip with three parts, which are the skin epidermis, the vermilion or the red zone or transient zone, and thirdly moving to the labial mucosa. A transection of the lip. How to distinguish the three parts of the lip. So here we have a thick epithelium which is keratinized as shown in the arrow, the keratin layer, and has many appendages, skin appendages. So this is the skin part. Moving to the transitional vermilion zone, which is also keratinized epithelium that is thin, less thick. And thirdly is the thick, non-keratinized mucous membrane, which is demarcated by the labial glands. Another representation of the skin of the lip, having skin appendages like hair follicles, sebaceous glands, and minor sweat glands. Also the vermilion border, which has no glands but is a keratinized epithelium. The labial mucosa is a non-keratinized with many minor salivary glands. So A showing the sweat glands, B are the sebaceous glands, and C are the hair follicles. This is a section of the lip skin. Again, here we see the keratinized epithelium with hair follicles and multiple sebaceous glands. Multiple sweat glands are also present in the dermis of the skin. The vermilion zone, on the other hand, has numerous connective tissue papillae with capillary loops, making up their red appearance clinically. It is composed of a keratinized, thin, translucent epithelium. The labial mucosa is a non-keratinized thick epithelium, showing from the basal layer, the intermediate, and the superficial keratinized layer. The connective tissue of the labial mucosa has dense collagen fibers binding to the orbicularis oris muscle. The submucosa contains many salivary glands. The lamina propria is short and has short papilla. Next is a schematic representation of the gingiva, starting with the alveolar mucosa, which has a thin, elastic submucosa binding directly to the periosteum, then the attached gingiva, the exterior part of the gingiva attaching to the bone using multiple principal fibers in the submucosa. Then is the free gingiva, which is not attached to any tooth. In between the free and the attached gingiva is a free gingival groove, which is a depression in the epithelial mucosa. F is the gingival margin, and this is the gingival sulcus, followed by part of the junctional epithelium, which is bound to the tooth directly. So again, moving from the gingival margin, which is a thick keratinized mucosa, to the sulcular epithelium, which is non-keratinized, and the junctional epithelium, which is the most thin non-keratinized layer. So we move from keratinized to para-keratinized to completely non-keratinized tissue. We see in the submucosa gingival ligaments which binds the tooth and the gingiva. Here's a section of the attached interdental gingiva. It is a keratinized epithelium which masks the vascularity in the connective tissue. Thus, they appear as light in color, light pink in color. On the other side is the junctional epithelium, which is a very thin non-keratinized epithelium binding directly to the enamel. Again, junctional epithelium, sulcular epithelium, and the gingival thick keratinized epithelium. This is an interdental papillae, the keratinized epithelium showing. So this is the oral epithelium, thick keratinized, the start of the gingival clavicle, the oral sulcular epithelium, and the junctional epithelium. The junctional epithelium starts from the cemento-enamel junction to the base of the gingival sulcus. It has an external basal lamina and internal basal lamina. It is the most thin specialized mucosa in the oral cavity. Again, the junctional epithelium. Here is a closer look to the gingival epithelium opposed by the junctional epithelium. This is a section of the junctional epithelium because we see a very thin epithelium which has flat surface, no undulations, made up of multiple 5 to 6 layers. Supposedly there should be an internal basal lamina and an external layer of basal lamina. These are multiple periodontal fibers. This is also a section of an interdental or dentogingival junction. Here is the junctional epithelium. Here is the gingival epithelium and a small indentation of the epithelium on the level of the cemento-enamel junction, which demarcates the free gingival groove, distinguishing the attached gingiva from the free gingiva. Here we see a big section of the free gingiva, which is a keratinized epithelium. These indentations are a keratinized epithelium with many depressions forming the stippling of the healthy gingiva. Next is a section of the gingival mucosa with the basal, precursal, and parakeratinized outermost layer with many indentations of the connective tissue. The interdental papilla occupies the space between two adjacent teeth and has a triangular wedge shape. Here also it shows the variation of the free gingiva interdental papilla, showing a variation in the epithelial ridges and connective tissue papillae. The interdental papilla contains dense collagen bundles and principal fibers that connect the two teeth with the gingiva. This is the alveolar crest. A closer look for the junctional epithelium, which is a very thin non-keratinized lining. Very thin layer with an internal basal lamina facing the connective tissue and an external basal lamina facing the tooth. The junction epithelium has a high turnover rate. These cells have less tonofilaments, less desmosomes, and thus they are less differentiated than in the normal non-keratinized epithelium. Another section of the interdental papillae showing a keratinized epithelium. The gingival col is a depression between the anterior and the posterior papilla of one tooth. It surrounds the tooth and it's a continuation of the very thin junctional epithelium. The submucosa of the col constitutes a group of principal fibers tying the teeth together. the groups of the principal gingival fibers. A normal gingiva looks light pink in color and has some stippling. Macroscopically, the free gingiva or the marginal gingiva, there's the attached gingiva, and between both is the free gingival groove. Also, there's the mucogingival groove or junction separating the attached from the alveolar mucosa. A section of the junction between the gingiva, non-keratinized epithelium, and the alveolar mucosa, which is a keratinized epithelium. The groove in between is the mucogingival groove. Here is a section of the hard palate, which is a masticatory keratinized epithelium, a connective tissue, and we see no presence of the submucosa, where the connective tissue binds directly to the bony areas. This can be seen especially in the central region, where we have the medial raphe and the epithelial rugae. A more magnified section showing the keratinized epithelium of the hard palate. This is a section of the posterior part of the hard palate showing a presence of submucosa containing minor salivary glands, and this is the junction with the alveolar process showed here. Again, a section of the oral mucosa of the hard palate showing the keratinized epithelium and the lamina propria. Here's another section of the hard palate showing the epithelium, the lamina propria, and the presence of submucosa in the posterior palate. The submucosa may contain salivary glands, adipose tissue, and neurovascular bundles. The nasal part of the soft palate showing the presence of an columnar epithelial cells, ciliated, which are ciliated, with small goblet cells that are clear under the stain. Where the hard palate meets the soft palate, we see a keratinized epithelium and a non-keratinized epithelium of the soft palate, and on the junction, the taste buds. The tongue is divided into anterior 2/3 and a posterior third that is lymphoid tissue, and it is distinguished from the anterior papillary part by the sulcus terminalis. This is a demineralized section of the ventral surface of the tongue, which is known to be highly vascular. A section of the dorsum surface of the tongue showing a keratinized epithelium with many numerous filiform papillae, having the shape, thread-like shape of cones with lateral leaves. A rather magnified section of the filiform papillae, which is an intraepithelial organ. These filiform papillae have no taste buds, so they are only for friction purposes. Again, the feel-like or the thread-like filiform papillae. Filiform papillae under the microscope. This is a section of the dorsum of the tongue showing a fungiform papillae with taste buds that could be found on the surface and a foliate papillae. This section of the epithelium is non-keratinized. A magnified section of a foliate papillae in a non-keratinized section. Also a section of a foliate papillae found on the lateral surface of the tongue. A fungiform papillae with multiple taste buds. Next is the circumvallate papillae with the raised edges. We see a lot of taste buds on the lateral surfaces, and the trophy where empties the von Ebner's salivary glands. Similarly, a circumvallate papillae with both tranches. A higher magnification showing numerous taste bud organs on the lateral side of the papillae. Here is the trench, the taste pores within the epithelium, taste buds on the surface. This is the base of the tranche of the circumvallate papillae. We show in the submucosa some mucus glands. Again, the submucosa of the circumvallate papillae showing mucus glands within the muscles. This is a taste bud composed of an outer taste pore, supporting cells, and here are neuroepithelial cells which are connected to a nerve plexus. Again, many types of the sensory cells can appear as light and dark cells. and the outer pore where the chemicals bind. The specialized epithelium of the lingual tonsils make masses, deep crypts within the epithelium that contain a lymphatic tissue or lymphoid tissue. The mucus glands could also be present in the submucosa. And lymphoid tissue within the epithelium. Thank you for your attention.